Hello, everyone. Welcome to the training session Ethical Issues and Conflict in Mental Health and Wellness Navigating Ethical Dilemmas and Conflict of Interest. This presentation will address common ethical principles and potential dilemmas and offer strategies for resolving conflicts with the content of mental health practice. Let us begin. My name is Christopher Pickney, and I'm pleased to guide you through this discussion tailored for undergraduate students. As we delve into the complexities of mental health and wellness, we will explore the ethical challenges and conflicts in this field. These include navigating dilemmas, addressing conflicts of interest, and ensuring we uphold the highest standard of integrity and care. This session will equip you with practical knowledge and tools to effectively recognize and address ethical issues. Together, we aim to foster a deeper understanding of how ethical consideration impact mental health practices and personal decision making, empowering you to navigate these challenges confidently. Thank you for joining us today, December 16, 2024, for this critical discussion. Let us embark on this journey to enhance our ethical awareness and strengthen our ability to contribute meaningfully to mental health and wellness. Ethical standards are fundamental for mental health and wellness professionals to ensure that the welfare and rights of clients maintain professionalism and to preserve trust within the therapeutic relationship. These standards guide decision making, promote confidentiality, and establish boundaries that support a respectful and effective care environment. In this presentation, we will explore core ethical principles in the mental health and wellness field, conflict of interest and personal values in decision making, and ethical dilemmas that may arise when working with clients and how to navigate them. By examining By examining these topics, you will understand how ethical standards shape practices and decision making in mental health care, ensuring clients' well being is always prioritized. One common conflict of interest in mental health is dual relationship, which occurs when a therapist holds multiple roles with the client. For example, a therapist, a therapist might work with a close friend or family member. Such a situation can create bias, impair objectivity, and blur professional boundaries. To resolve this, therapists should avoid dual relationships. Whenever possible, establish clear professional boundaries and, if necessary, refer the client to another not proportionally involved professional. Another conflict of interest arises when financial incentives influence a therapist's recommendations. For instance, a therapist might receive a compensation for requesting certain treatments or products to clients. This can determine trust in the therapeutic relationship and affect the therapist's objectivity. To prevent this, transparent should be transparent with clients, strictly adhere to professional ethical rules, and refer clients to unbiased professionals when financial conflicts occur. Sometimes therapists value conflict with their professional decision making. For example, if a therapist holds a strong personal belief about substance abuse, it might affect how they approach a client treatment choices. In these situations, therapists must reflect, seek supervision, and prioritize the client's anatomy and well-being. Resolving these conflicts requiring putting aside personal biases and ensuring that decisions are centered on what is best for the client. Let's now review the core ethical principles that guide mental health practices. The principle of monotony emphasize the importance of respecting clients' ability to make informed decisions. Beneficence involve promoting clients' well-being, while non-malfeasance focuses on avoiding harm. Justice ensures fairness and equality treatment, and confidentiality protects the privacy of sensitive clients' information. Integrity involves maintaining honesty and professionalism in all aspects of practices, and these practices form the foundation of ethical decision making in mental health. An ethical dilemma often arises when confidentiality must be balanced with client safety. For example, if a client discloses suicidal thoughts, but confidentiality agreements prevent sharing this information with family, the therapist faces a difficult decision. In such case, the therapist must prioritize safety while maintaining confidentiality as much as possible. It is essential to discuss the limit of confidentiality with the clients upfront, involve family when necessary, and seek guidance from supervisor or colleagues to make informed ethical decisions. Another dilemma arises when cultural practices conflict with professional ethical standard. For example, cultures emphasize the involvement of family members in therapy, while professional ethics prioritize respecting a client anatomy. In these situations, the therapist must exercise cultural competence, which means understanding and respecting the client's cultural value. It may involve open discussion with clients, exploring culturally appropriate solutions, and consulting with cultural experts or supervisors to ensure that cultural values and professional ethics are honored. When faced When faced with ethical dilemmas, there are key steps to follow to navigate them effectively. First, identify the conflicting ethical principles at play. Then, the ethical guidelines from ACA, APA, and NASW will be reviewed. Reflect on personal values and potential biases, and seek guidance from supervisor or colleagues when necessary. Ultimately, the therapist's responsibility is to prioritize the client's well being while making informed ethical decisions that adhere to professional standards. In conclusion, ethical decision making is essential for providing high quality, trustworthy care to clients. Adhering to professional ethical codes safeguard client rights and ensure the integrity of the therapeutic relationship. Mental health professionals must engage in ongoing self reflection, develop cultural competence, and seek collaboration with others to navigate complex ethical dilemmas. By doing so, we uphold the trust and well being of our clients. Thank you.